Hi, my name is Jenny Lockhart and I'm a specialty doctor anaesthetist in NHS Fife, and I'm presenting the Epidural Analgesia in Labour audit. My colleagues who helped me with this audit include Jennifer Prock, who is a specialty doctor anaesthetist in NHS Fife, David Milne and Laura Gill, who are both consultant anaesthetists in NHS Fife. So a bit of background, first of all, as to why we felt this is an important audit to do. Epidural analgesia is considered the gold standard for labour analgesia, and around 31% of women in Scotland last year received an epidural. The Royal College of Anaesthetists did publish guidelines with regards to best practice with an epidural and set 4 main criteria as to successful epidural insertion. So these include, firstly, adequate pain relief within 45 minutes of insertion, so that rate should be over 8 to 8%. An accidental dural puncture rate of less than 1%. Epidural replacement should be less than 15%, and satisfaction at follow-up should be over 98%. So our hospital, Victoria Hospital in Kirkcaldy, has around 3,000 births a year, so it's a very busy maternity hospital. So we thought by checking if our department meets these standards, we are able to identify any areas for improvement to hopefully enhance patient safety, maternal satisfaction and reduce any complications associated with epidural analgesia. So the methods included retrospective data collection via the online Badgernet system, and data was inputted into Excel and analysed using Excel. And adequate pain relief was identified confirmed if there was documentation that maternal well-being was improved or that the epidural was working by either the midwife or the anaesthetist. So the results, there was 257 births within a 4-week time period that had around 36 patients requiring an epidural. There was 2 failed attempts, so there was 34 patients who actually received an epidural. There were, with regards to the standards, only 62% of women achieved adequate pain relief within the time frame of 45 minutes, and that is mainly down to documentation. Our accidental dural puncture rate was 0%, our epidural replacement rate was 6%, and our satisfaction at follow-up was 99%. However, that was only in 17 women, 50% patients were not followed up. So I've kind of alluded to that. There was actually 3 main themes that we felt there was areas for improvement. So these include poor documentation. So only 20% of, there was 20% of women who didn't have any formal epidural assessment within the time frame, and only 27 of patients of the 36 that requested an epidural actually had documented information that we were able to look at and analyse. In addition, educational opportunities, so only 3 epidurals were performed by core trainees. Actually, there was about 16 out of the 36, so 47% of epidurals were actually done in hours, so there's a lot of scope for educational improvement and opportunities there. In addition, follow-up rates were poor, so only 17 of women were followed up, and that is probably likely due to the anaesthetists being involved in different situations. So we hope to improve this by alerting the staff that epidurals obviously need to follow up before discharge, and also the consideration of phone calls. So I'd like to thank you for listening to the epidural audit, and hope you like the poster. Thanks very much for your time.